This is a Dutch testing report tutorial to assist you with the interpretation of results. These videos are for educational information only and not for medical advice. The results that we're going to show on the screen are not from your actual results, but are just here to help with the conversation. When we're looking at cortisol, we've got a lot of data that we can work with. The primary bit of information we want to look at is the free cortisol pattern over time. So we've got 4 measurements. The waking measurement, remember, it's a waking urine sample. It's not waking cortisol. The cortisol that we're seeing here is the entire night's exposure of free cortisol, right? It's not the cortisol right when you wake up. Right when you wake up, your cortisol tends to go up quite a bit in the first few minutes, and then it stays elevated for a good hour before it starts coming back down usually. So this 2-hour sample in the morning is a really good reflection of that entire surge of cortisol. It's typically come down quite a bit by the afternoon, and then usually at its lowest point around bedtime. So in this particular case, you're going to want to look at these values, which overall are pretty high, but look at the individual values to see at which point it's high. You know, is there dysfunction not just in the fact that there's excessive free cortisol, but also in the particular pattern of cortisol as it's supposed to go up and down in this particular fashion. Then we're going to add those up, right? That tells you the days total for free cortisol, and in this particular case, it's elevated. Right, so that tells you circulating cortisol appears to be elevated throughout the day. However, that's not a good reflection of overall glandular output of cortisol. The free cortisol is only about 1 to 3% of the total. So metabolized cortisol represents about 75% of the total cortisol production. So that's really a better marker for overall production of cortisol. And in this case, it's on the low side. Right, so that tells you the cortisol production doesn't seem to be that high, even though the free circulating cortisol is pretty high. Okay, so we can look a little bit further and see some other things. So cortisol is made how? By the adrenal gland. Why? Typically because the adrenal gland gets stimulated by the brain by a signaling hormone called ACTH. Then the cortisol circulates as not just cortisol, but also cortisone. Okay, so we've got the active cortisol and the inactive cortisone. So we can also look at that pattern of cortisone. If the cortisol is circulating as both or either one of these, it's good to confirm that up and down pattern by looking at the cortisone. So there's a back and forth, and then that's mediated by this enzyme called 11-beta HSD, and then it's metabolized to the cortisol and cortisone metabolites. So when we want to know again about total production, we're just adding all of those up. And you can see the numbers there are usually pretty big. Even in a case like this, where the total of these metabolites is relatively low, those numbers are big because they represent such a large fraction of the overall cortisol as those metabolites. So in a case like this, where the free cortisol is so high and the production does not seem so high, what we may have here is low cortisol metabolism or low cortisol clearance. The most common reasons that we would see that would be low thyroid, poor liver function. Those are some things that providers might be checking on in a case where it seems that the cortisol is not metabolizing very quickly. In other situations, you might have the opposite, where the free cortisol is relatively low and the metabolites are high, which would be a picture of increased cortisol production and increased cortisol clearance or metabolism. That's often seen in obesity, elevated thyroid, elevated long-term exposure to elevated cortisol levels. So those are some things to think about here. Now, one of the reasons why you may sometimes see elevated free cortisol and not elevated metabolites might be that you may also have a situation where the cortisol is not readily deactivating to cortisone. So usually there's this back and forth. Well, if the balance of it doesn't push towards cortisol very much, you might see higher levels of free cortisol than free cortisone. The literature would suggest, however, that when you really want to ask that question, like what is the overall preference? Is the cortisol spending most of its time in the active form or in the inactive form? The best way to look at that that is to look at all those metabolites. We got a whole bunch of cortisol metabolites and a whole bunch of cortisone metabolites. Well, which one's really predominating? So if it's favoring cortisol, then the cortisol is staying in its active form. And if that's the case in a situation like this, where you appear to have sluggish cortisol clearance, and the cortisol metabolites are dominating the cortisone metabolites, even more of a reason to potentially check on the thyroid, because low thyroid, the literature tells us, correlates with low cortisol clearance or metabolism, and also a lack of pushing that cortisol towards the inactive form cortisone. So if, on the other hand, this is pointing in the other direction, then it seems like overall there's actually a bit of a deactivating of that free cortisol to cortisone. But again, the metabolites are really the better marker for this. The other thing that you may want to look out for in a situation like this, where the free cortisol is relatively high and the metabolites are relatively low, is looking for a real volatile pattern, in the sense of, if the overall cortisol free is elevated, but it's mostly from just one point that is, exceptionally high in the early morning or in the afternoon, do keep in mind, and this gets a little bit complex, but keep in mind that the pattern of the metabolites is different than the free cortisol. So the free cortisol and free cortisone are going up and down throughout the day like this, whereas the metabolites tend to be a lot flatter, and then they'll go up a little bit in the afternoon and back down, something like that. So it's not as volatile of a pattern, and that's another reason why it's the better marker for overall production. But there is a difference in terms of the kinetics, or the timing of when the free cortisol is going up and down and when the corresponding metabolites are coming through several hours later. So that can be in some cases where you've got an overall elevation, but a big up and down swing potentially throughout the day. That's something to potentially watch out for. So I hope that's been helpful. We do have other educational videos and information at DutchTest.com that can assist with the understanding of your results. If from a patient perspective you have some questions, please do see your healthcare provider for those, and we thank you for testing with us.